What can you do at home to treat a concussion? Well, first of all, you should be doing this in conjunction with a trained therapist, clinician, healthcare professional, doctor, whoever it may be. But oftentimes you may be waiting at home for a few days before you actually get your appointment, and you want to make sure that you're doing the right things while at home. So here's some tips and tricks for you as a patient recovering from a concussion, and here's some things you can do in those initial few days before you get your appointment that can help you recover faster. There's probably a lot of you out there watching this right now thinking, damn, I wish I would have known this earlier. But nonetheless, hopefully we can help a few of you that may be in the acute stages. Number one is, I'm going to say this, rest, but only moderately. Okay? There's no more dark rooms. There's no more avoiding screens and just laying in bed all day. Okay? Moderate rest. So you want to take it easy, but you're still allowed to do activities. You're still allowed to watch TV. You're still allowed to go for walks. You're still allowed to read. You're still allowed to maybe even work from home, answer a few emails. Okay? No more cocoon therapy. That's out. If you go and then see your healthcare practitioner, your doctor, whoever, and they tell you, well, don't do anything. Make sure you go in, dark room, and you don't go on your phone. You don't watch TV. You are in the wrong place. This person is out of date. Okay? The evidence now is showing that resting for any more than 1 to 2 days after your concussion injury starts to become detrimental for you. It actually makes you worse. Okay? I don't know how many patients I see on a daily basis that come in and say, I did all the right things. I took a month off work. My doctor told me, and I was still having issues, so they told me to take another month off work. No. The fact that you took a month off work is probably the reason why you're still not better. You should be taking maybe 1 to 2 days off, moderate rest, and then starting to get back into your activities, gradually reintroducing back into work, whether that's starting to work from home and then going to half days and then going to full days as tolerated. That's what you should be trying to do, not pulling back completely for a month at a time or a week at a time. It's take 1 to 2 days, maybe max, and then start gradually reintroducing back in. Even if you have symptoms, it's not a big deal. The rule of thumb for this rest phase is you can do anything which doesn't, one, increase your risk for getting another concussion. So anything that doesn't have increased risk of hitting your head. So you can't play sports, okay, but you can still exercise in a light or moderate way. You can't go ice skating, but you can go for a walk, okay? I wouldn't ride my bike, but you could still go for a walk. You can still walk the dogs. You can still clean your room. You can still, mow the lawn. These are things that you can still do, okay? You can get your little bit of activity, and you don't need to kind of pull yourself back. Just anything that doesn't increase the risk of getting another concussion. And two, anything that doesn't increase your symptoms to a significant degree. If you're sitting around and you have a headache of 4 out of 10, and you get up and you go for a walk and your headache is still a 4 out of 10, that's fine, okay? Just because you have a headache doesn't mean you can't go for a walk. If you go for a walk and your headache spikes from a 4 to a 6, well, find a bench, sit down for a little bit, let the headache come down a little bit, and then continue on your walk, okay? Just because your headache increased with going on a walk doesn't mean you shouldn't be going on walks. It just means that when the headache comes up, take a break, let the headache subside, and then continue on doing it. If you're going to be working from home or doing anything like that, if your headache starts to go up or you start to feel a little dizzy, a little bit weird, wonky, put the work down, go do something else for a bit. Let the headache subside, and then come back to doing whatever you're doing. So the rules of thumb are you're allowed to do anything which doesn't increase your risk for getting hit in the head and doesn't increase your symptoms to any significant degree. So that's number one. Rest for 1 to 2 days, but only moderate rest, not complete full rest. Okay, that's out. That's old school. Number two, go for walks. Stay active. Concussion causes blood flow reduction. So does inactivity. If you put those two things together, concussion plus inactivity, your blood flow reductions worsen. which means that your recovery now becomes much more difficult. So the treatment for blood flow reduction is actually exercise, but you have to do it in the right way. So again, you want to be staying at that sub-symptom threshold level. You don't want to be doing anything too vigorous that increases your symptoms to a significant degree. If you can go for a run and it doesn't increase your headaches, go for a run, right? I wouldn't suggest that to start, but go for a walk. If you get symptoms, take a break and then continue on your walk. But don't just sit in a dark room and do nothing, because that will exponentially make you worse. There's new research coming out showing that exercise, moderate sub-symptom threshold exercise, may actually be beneficial for your recovery and speed your recovery and reduce the chances of having chronic symptoms. So go for walks, stay active in those first few days after injury. But again, nothing that's going to be considered a dangerous activity or something that puts you at risk for hitting your head again. Tip number 3, diet. Cut out the crap. Okay? Concussion causes inflammation. Persistent inflammation causes the same symptoms as concussion and keeps the inflammation around. So headaches, fogginess, confusion, sleep difficulties, anxiety, all this stuff can be caused by inflammation, and all of that can be attributed to some diet stuff. Okay, so a lot of the foods that we eat are pro-inflammatory. Things like your typical refined sugars, processed foods, right? Your pop and chips, those are all pro-inflammatory. Fried stuff, gluten, dairy, pro-inflammatory. Processed meats, sandwich meats and things like that, inflammatory. Okay, you should be eating healthy during this time. Fruits, vegetables, and high quality lean protein meats, not processed. Okay, high quality meats, fruits, vegetables, and for grains and carbs, avoid the gluten side of things, because that can be very pro-inflammatory to people. Even if you don't have a gluten sensitivity, you may not know it, but it can be promoting inflammation within your body. So cut out any of the garbage foods. Try to eat very clean during your recovery. When you cut it out, you need to cut it out 100%. Because if you're still going to, well, I had, a Timbit, or I still like sugar in my coffee, it's still doing the same thing to you. So you have to eliminate it for the next couple weeks, and just, hopefully that will help you to recover better. This is all fairly early research, right? So I wouldn't kind of hang my hat on this, but we do know that inflammation causes persistent symptoms, and we do know that a lot of foods cause inflammation, and if we can eliminate those foods, we may have a better chance of reducing the inflammation that's going on in our bodies. Some newer studies that are coming out with animals are looking at actual supplements, so things like fish oils, magnesium, curcumin, creatine. That type of stuff has been found to be potentially beneficial for recovery, but most of the studies we have are only in mice at this point, so not enough to provide a recommendation as of yet. I know a lot of people are probably going to ask that question, but the best thing you can do is just avoid the crappy foods. Okay, eat clean, healthy foods after your concussion injury for those first 3 to 4 weeks kind of thing. Okay, so those are the tips. Summarized again: what can you do at home to treat a concussion? Well, you should really be seeing a trained healthcare practitioner, and the research is showing that if you see them within the first 5 days, that's likely the best. If you're waiting for your appointment and you haven't got in yet, and you need some tips and tricks to do at home, number 1, rest, but only moderately. Okay, no more dark rooms. Get rid of all that idea. Do activities as long as they don't provoke your symptoms to a significant degree. You can read, you can watch TV, you can do a little bit of work from home, you can do some homework, that type of stuff. Number 2, stay active. Go for walks, exercise, moderate to light. And number 3, diet. Cut out the crap. Try to eat clean for the next little bit. Okay, so those are the best tips I can give you in terms of helping yourself while at home before you get in to see your healthcare provider.